So measurement-based care essentially is the use of patient-reported outcome measures to help to monitor how treatment is going. And it's used as a regular and routine part of care, and it allows us to think about treatment adjustments. I think the best way to highlight the differences between measurement-based care and routine assessment is through the model that we utilize, which is called Collect, Share, Act. So collect is where we collect those measures regularly and repeatedly with multiple mid-treatment measures. And the idea is we want to do this frequently enough so that we can use the data collaboratively with the client to adjust care in this episode of care. And we also want to make sure that we're engaging the client from the beginning by talking about the rationale for measurement-based care, how we're going to use the measures, how we're going to incorporate it into our treatment. And then we do share. So share is where we actively use the data, where we talk about it with the client. We use it to explore the context of what the client is experiencing. To me, it's like asking, how are you doing? But using the data and the measures to help guide that conversation. So ensuring the client knows what the scores mean, that it resonates with them, that they agree with what the information is suggesting, and then exploring that, really getting curious, as my colleagues like to say. And we also want to share that data with our colleagues in the record as appropriate for our settings, and so that we have it for ourselves, because we are going to want to refer back to that data for ACT. And ACT is where we really sort of back up and look at the treatment trajectory. How is this person doing over time? And to me, this is where we're sort of asking, how are we doing together at helping you reach your goals? So we look to see if there's improvement, worsening, no change. And we ask the question of, if we're not seeing the progress we were hoping for, should we do something different? Should we make some kind of adjustment and have a collaborative conversation, incorporating all of the data, including the measure data, with the client in figuring out what those next steps might look like. So in that way, we have a shared language, a very collaborative process that enhances therapeutic alliance and partnering.